Hello, ladies and gentlemen. My name is Dr. Dil QTMHC. I'm a consultant psychiatrist with the Transcultural Clinical Consultation Service. Thank you for this opportunity to talk to you about the work that I do with the centre. I've been with this team now since May 2006, and my role has primarily been to provide clinical supervision to the Transcultural Clinical Consultation Service. Increasingly, we've had a number of referrals coming through for people where we don't have clinicians from that particular cultural background, and I've been involved in doing a number of direct clinical assessments, sometimes individually, and providing reports back to support people and treating doctors. But also I've been involved in developing our joint assessment model, and the joint assessments are a way of matching clinical and cultural assessments and integrating those into a shared process. The joint assessment has usually involved a clinician and a cultural consultant from that person's culture trying to undertake an assessment that at its core aims to assess the explanatory model of that person and describe that in the report that we send to the referrers. In terms of the process that I've followed in doing these assessments over the years, it's very important that we have some time at the beginning of the assessment to talk between myself and the cultural consultant about what the aim of the assessment is and how we'll conduct the assessment, and also to make some time at the end to discuss what we've found and to decide what we put into the report. The report then I would prepare and both of us would sign off on it. My role as a psychiatrist is been mainly to focus on the clinical issues, and in particular looking at the diagnostic, risk and treatment issues. And the cultural consultant's role has usually been to focus on the cultural aspects, the socio-cultural aspects of the case, and on occasions to assist in interpreting. But it's very important that their role is seen not as an interpreter. If they do need to interpret, then I often ask them to spend some time in discussing freely with the patient about the cultural issues without having to stop and interpret, because I feel that does interrupt the flow of their assessment. And then that information can be provided to me at the end to put into the report. So the joint cultural assessment and clinical assessment is a way of trying to elicit the explanatory model, and my hope is that we do that in an integrated way rather than two parallel assessments, with me seeing the person for the first part of the interview and then the cultural consultant seeing them for the second half of the interview. By setting up a venue that is culturally safe and sensitive, hopefully the person can bring forward cultural issues or spiritual issues that they would not otherwise have brought up with mainstream mental health clinicians. For example, beliefs about things like witchcraft, which are very important for us to know about and to integrate into the assessment report. Hopefully that assessment flows with both of us asking questions and exploring things together, and that's what we try and achieve over the course of that interview. A number of issues do come up regularly from over the course of these assessments, and one of those includes trauma. And the population that we see often have come from really traumatized backgrounds, and that can affect their engagement with treating services, particularly government-based services. In terms of the trauma, I try not to delve into the trauma. As a consultation service, we don't see people in an ongoing way, and I don't believe that it's appropriate to explore the trauma if you're not going to follow through on that and assist people with that. If people volunteer that and want to explore it, we do, but we try and keep it in a fairly contained and brief way. This assessment model does allow for us to really gain a holistic understanding of the person and to make sense of their experience and provide that in a report. It's been an interesting experience for me, and it's a process that we'll continue to develop and indeed start to do some research on. Thank you for your attention.